through here.
Yeah.
And you grab the shoulder blade underneath.
Okay.
And then thumb forward, and you're feeling for the scapula. I'll feel it.
You're doing great in it.
To come out.
Okay, so one thing is you're ending up with his arm kind of away from your body.
Mm-hmm.
One thing that I would do is, and you're also holding it.
Hold it like a baby.
Yeah. Okay. Mm-hmm. So then you're absolutely right that you're in there. So then we're gonna come up. Bouncy, bouncy. Okay. So what did you get for an infill on that side?
Here?
Yeah.
What does it feel like?
Yeah.
Oh.
Does it feel bony?
No.
Does it feel empty?
No, it feels bouncy and tissuey.
Okay. So we'll see a little bit later today if he has tight lats.
Mm-hmm.
So it could be either muscular or capsular, right?
Yeah.
So the difference between the two would be if you really get to the end range without resistance, and then when you get to the end range, then it's kind of bouncy. It's hard for shoulder motions to really identify that because we have all this wonkiness with the scapula. So I'm perfectly fine with you narrowing it down to those two.
Okay.
Good job. All right. How would you... Yeah. I would like you to measure shoulder flexion active range of motion.
Okay. So, Mike, first you're going to take your thumb. You can take your thumb and bring it all the way up. And then once you hit your end point, you can stop. And then stay there for me. And
Scott.
the still arm.
Chair. There you go. I have to look out for my peeps.
This is going right,
Yeah.
dissecting the thorax
Okay.
and the humerus.
So would you say that 50% of his humerus is above that line? So I would go this
Down.
way. Yeah.
That's why
Okay,
you
I'm
got
going
the
to
chair,
just
so
repeat
she could
myself
get
all
low.
day.
See that?
And then this.
Sorry. No, that's fine.
You feel
Like your
better.
shirt too
I just said
Yeah.
that about that.
It was a rough morning. Yeah, I'm
And
there
I
with
would
ya.
put your going just right square
Touching
yeah.
on. Oh!
Yeah, apparently I'm going to
That's
repeat
helpful.
every word I say.
Smooth.
So yeah, perfect, yeah.
So, here?
I think that looks perfect. Perfect. That's good on purpose.
Did you get her the chair so she could like get at the right perspective?
Exactly.
Okay.
Exactly. If she was trying to line that up from up here, so I'm gonna have you up here again. If what you end up doing is you end up putting it there, because this is where you're looking instead of being able to get down here. So I would have lined it up like that, and I'm getting 138. Well, he changed.
I'm not as
It's all
active.
It's always gonna be the patient for this summer. Okay? After this summer it'll be you, but this summer it's always your patient. Okay? All right. Thank you very much. So
Still rolling?
It is. Anything you want to say?
So remember that when you are measuring motion at a joint, you're first going to take the person through the passive range of motion, feel the end feel. You're also getting an idea of how far they can go, okay? Then I'm going to come in, sorry, Mike.
Yes.
We're going to take some measurements of your shoulder and see how far you can move it. The first thing I'm going to do is move it for you to see how far I can move it, and then I'm going to ask you to move it. Okay? So I'm bringing you up. Wow, looks like you have pretty good range of motion. And you're not even cheating. Your back's not coming up. Your shoulder blade's not doing anything crazy. Are you comfortable staying there for a second? Okay, good. Thanks. Come down here. Line up my goniometer. Oh, you're not even ticklish. Okay? So then I'm going to come down and go, okay. Now what I need you to do is do that exact same motion yourself. Okay? So go ahead and do that. And then I'm lining up the goniometer again. Okay? So that would be the full protocol of how you would do that.
It looks so easy.
That's what 25 years of experience you get.
So the passive range of motion, you don't have to keep your hand on their arm while you line up the gun, because it'd be hard for that one.
Right. So for your shoulder, we have gravity as our friend. So I was being sloppy because I didn't want to walk all this way. Get my Glenohumeral. So the other thing is, you're taping and I came on this side. Isn't that nice of you?
Yeah.
So the other thing is that I know that he can roughly get to 160. I mean, we know that he's exactly at 144, but we know that he roughly can get up there. So I'm going to have my goni this way before I get him in position. Okay? You don't want to have it here, have his arm up, and then go, oh, you know, right? So I'm going to have you come up here. So I'm actually going to keep my hand on there, but now what I'm going to do is slide that arm underneath my hand. Mike, you're getting tighter. There you go. All right, I'm just going to have you come back down. I lied, I got 148 that time. So we would document that as 0 to 148 with a capsular end feel or a muscular end feel. Okay. So for passive range of motion, you're going to document the range and you're going to document the end feel. Do you document end feel for active range of motion? Good. Okay. All right. So we're going to move on to the rotations. So Mike, I'm going to have you just scoot a little bit on the table that way for me, please. Come. Oh, yeah. Yeah. Make sure you haven't. I'm back to repeating myself. There you go.
Don't worry, you're not in the way.
Okay.
No.
Okay, so now what you're going to do is if they have the available range, you're going to have them come up to 90 degrees. This is a very So you're going to have them abducted to 90 degrees, the elbow flex to 90 degrees, and after all that moving that way, I need you to move this way just a bit. You want to have, go ahead and come this way a little bit more towards me, your body, there you go. You want to have enough room that the person could potentially come off the table, okay? Now, we talked about with abduction, what were the common compensations? There are two for abduction.
Scapular rises.
So, the rotation of the scapula and shoulder elevation. So those are the two compensations for abduction. What is the compensation for flexion? I didn't really talk about it, so I should just tell you. The back coming up. Okay? So one thing you could do when you're doing flexion is bend the knees. That'll keep the lumbar spine down on the table. That is something you want to compensate for with your goniometer. For external rotation or lateral rotation, there really aren't a whole lot of compensations, but I'll have one hand here. I'm going to come back. So I'm doing passive range of motion. I'm feeling end feel. Okay? It's nice and bouncy at the end. Very nice capsular end feel on that one. Okay? So now, when I come to measure that, Is Liz M getting married this weekend? Yeah. I have no comment. She told me. I just was thinking it was in July. All right. So the stationary arm is going to be perpendicular to the floor. Because of my height, I put it up. If you want to put it down, put it down. It just needs to be perpendicular, and you need to know so that you read the right angle, the correct angle, not the right angle. Because it actually needs to be. Then the moving arm is going to follow right along the ulna. Okay, and you're pointing towards the ulnar styloid process. So he's not quite. You can't look. Thank you. And the axis is going to be kind of right along the shaft of his humerus. So all of you that are over there probably should come over here.
I can move to the back.
Or you can just sit.
What?
It's up to you. Or you can sit and be in front. You don't always have to be in the back. I'm a little sensitive about that.
Okay.
I don't want you to feel like you have to go in the back.
All right. Well, thank you for sharing.
No.
I appreciate when you go in the back.
Oh.
Sarah? Was that you who said that?
Nope.
Neither one of us.
Oh, okay. Since I just said I'm sensitive about that, someone was begging for demerits. So now I have that. Well, that was Jen's laugh.
It's not me.
Sorry, Eric, did everyone?
Okay,
I know my voice really well.
so I have him at 80 degrees. Okay. Now, so then for active range of motion, it's going to be the same. So go ahead and just let your arm rest. So now, I'm going to have you bend your elbow a little
I'll
bit
sit
more.
down.
Good deal.
Yeah, that was stupid.
Okay.
Sit
And
down
that time I'm
still.
getting 81 degrees. Okay, typically active range of motion will be a couple degrees less than passive range of motion. Do you remember what I said was the amount of variance that's acceptable in goniometry? So it's 5 inter. What is it intra? 3. Okay, so he's within my variance. Okay, so that's fine. So for internal rotation or medial rotation, you're going to be coming down. Now here there's a huge compensation. Look what happens to his humeral head when I go down. So that one, again, I'm going to have my hand on there and I'm monitoring, but I'm also kind of, when I'm testing end feel, I'm also pushing down and then testing here. This is one of the very few times that we're actually crossing a joint to apply a pressure. Oh, sorry.
Oh, that's fine. I'm just getting a better angle.
You would think after all these years of being taped, I would be better about that, but I am not. Okay? The measurement's going to be exactly the same. You're just going in the opposite direction. Okay? Now, if some of you, Sarah Ty, do you mind if we use your shoulder? I'm assuming you're going to be off the table. Yeah. So she has more than 90 degrees, and that's why you do it off of the table, so that we would get a number that would be, she's probably 93, 94. Okay? So that's why you have the person off. You need this towel because if that weren't there, do you see what happens to the humerus? So it messes up our angles. We really want her to be perpendicular to the floor, and that's why we use the towel. But normally these things are so thin that we have to really roll them up. But see, now I've got her way too high, and she's not comfortable. So that's why I had it only as just one layer, like that. Okay? So let's go ahead and have you measure internal and external rotation. Should we talk about extension right away, or do you want to just measure these two? Just measure these two?
Yeah.
Okay. All right. So flexion, action.